Hello everyone, my name is Matt Viegas. I am a student physical therapist. I just finished my second year of a DPT program, so I am now in my third and final year of PT school. And one of the cool things I did last weekend was complete this cervical spine manipulation course hosted by the Institute of Clinical Excellence. So the discussion was led by Jeff Moore, and this was hosted at the Physical Therapy Balance Centers in Summerlin. So with R.J. Williams, a Torrey University, Nevada graduate, same institution that I'm going to right now. So pretty cool experience and everything. I just want to touch more upon the experience and maybe a little bit about physical therapy. Since PT, I feel I definitely need to talk about that more here so that you understand more about what it is that I'm learning as far as movements, positioning, and the different techniques, and sorting through when a patient walks in, how pain is limiting their function and what types of activities they like to do, and how to get back to doing those things as a physical therapist, designing that plan of care. So, with this topic, the cervical spine, the neck, there's a lot of very sensitive structures in that area because you have your blood supply that goes to your brain. You have, your nerves, arteries. So those are things that we're very careful with as physical therapists. It's a very safe profession, and even performing these manipulations, what I learned completing this course is that the techniques, if using what's called these levers properly to limit and restrict the motion available, then should be safe. And first and foremost, as a healthcare professional, we do a very, very strict job of making sure that the patient, when you or someone you know comes into the clinic, that we make sure there's nothing else that's medically emergent going on. So for example, if someone has a car accident, whiplash from a little fender bender, we go through very vigorously these different tests for movement to check the integrity of very important structures like ligaments that connect bone to bone, to make sure that everything is a-okay and good. Otherwise, we would maybe strap on a cervical collar and send that patient off to the emergency room, call an ambulance. But anyways, going back to this discussion on the actual course itself. Jeff Moore, he's a very smart, very wise, very bright individual. And what's really cool about it, with the Institute of Clinical Excellence, they do have social media presence. They do Facebook Live videos. They have podcasts. All these great content that's relevant for me, since I'm going to be a physical therapist soon. But just these discussions on the topics that matter within the physical therapy profession, and just building us up to what they term PT 2.0 instead of just entry level, which I'll soon be reaching. So with these discussions on the latest evidence, there's things like clinical practice guidelines, which aren't very strict per se, but at the bare minimum, especially for myself as an entry level or up and coming entry level physical therapist, that there's research and evidence that strongly supports when a patient presents with certain types of symptoms and patterns and risk factors, different age, that there's certain assessment techniques and things that I should be doing, I should be considering for that patient in order to make sure that we're providing quality care and making sure that patient is treated for the real thing that the patient has, instead of just hobbling and just throwing a bunch of tools and stuff at them. So what was really cool about this experience, I'm just a DPT student, but I had a lot of fun. It was mostly the team from physical, but I still felt like decent enough connection with them. Most of them are actually alumni grads from the institution that I go to, Torrey University in Nevada. So it's pretty cool seeing like that representation and seeing what clinicians that are already practicing in the field, what we still struggle with as a profession, or the types of, well, just the type of questions, types of knowledge that we still need to tease out, tweak out. So looking at like the different evidence, the reason for that Jeff Moore like really harped on why we need to know certain things is because, like I was saying before, with like medically emergent situations, you really need to know if the patient is going to quote unquote like stroke out on you. And one of the professions that gets a lot of flack for that are chiropractors who, you know, perform spine adjustments and whatnot, but get a lot of the unfair blame for patients who really weren't a good fit for the adjustment in the first place. And so one of the things we really harped on was catching that, what's called a non-ischemic transient attack, which is basically like a stroke. That's something that should really pop out. Even for me, it should be really obvious that like, oh hey, like this patient, like there's something pretty funny about like what the patient just told me, that like I should probably send them off somewhere else to make sure they get seen by the healthcare professional that has the appropriate tools in order to assess the patient and make sure, rule out just there's nothing else going on. That was the very like biggest point and talk about the whole thing. Just harping on like we're direct access providers. People can see us coming off the street. We need to be doing a very good job of making sure that there's nothing else going on, and that it's not just simply saying, hey, hands off, I'm not going to do a cervical spine manipulation. It's very, very important, very key for PTs to be adamant about making sure their patients are an appropriate fit for physical therapy and making sure that they are seeing the appropriate healthcare professional if needed and being redirected to there. So the actual manipulations and stuff, I was pretty psyched about doing these. And one of the cool things is that I had my classmate there, so I wasn't alone. I had a lab partner that we know each other's like strengths and weaknesses, because we've done like how many lab practicals throughout PT school, and just going through and like practicing our handholds, positioning, lots of stuff with PT school that I'm not going to get into. But basically being able to be with real PTs and like practicing these different handholds, different techniques, and like knowing, especially for me, like understanding the mechanism of what is going on. Like I know in depth now the kinesiology, like the arthrokinematics, like Sal Imp, which you'll get to if you go through PT school, and like which ways the facet joints, these vertebrae are moving, and what is a net effect that I'm looking for. So it's pretty cool to see all this like textbook knowledge that I know like in action, and then seeing the tweaks that Jeff Moore had, like these hacks that really improve patient care and are like really cool. So I won't spoil that. If you want to know what it is, you got to take the course. I took a lot of really good notes. I mean, you're welcome to like reach out to me on Snapchat or whatever and just ask about a few things, but that's Jeff Moore's content, so I'm not going to give that away. So the other thing, there was a lot with this course because it was a 2-day course. It wasn't just about here's these techniques, go practice them, whatever. Like there's an actual culture behind why this program is very successful, and like the cost effective like ROI, uh, return of investment, like I think it's pretty good, because especially as a student, there's a student discount, and like they're really not asking for too much for a 2-day course. It was $400 for me. So I mean, I know I'm still a student, but like knowing this, what I know now, like if you have any issues with your neck, I'm sure you'd feel pretty comfortable with me if I was going through what I just learned and assessing what's going on. Of course, sometimes headaches, neck pain might not be fit for PT, but when it is, the treatments that I just learned are top notch, like amazing. So it was really cool being able to see the types of questions that real clinicians are asking, and being able to see a little preview teaser of what I should expect once I graduate next year. Now, as far as the course, one thing I did want to cover is how Dan Crusoe was giving his talk for the very first time about concussion, and that is an area of research that is very much so in its infancy. So it was interesting hearing that discussion and seeing a reinforcement of things that I learned. I've basically covered everything you could possibly know within PT school, at least the things that are important before going on clinical rotations. And seeing how these tests that I know for assessing balance, for assessing the vestibular system and like where your head is positioned in space, is pretty cool, pretty neat, especially because the physical team, FYZ ICAL, focuses on balance, so they focus on these vestibular issues. And how I've heard the guest lectures from RJ about the vestibular system, just the basic anatomy, how it functions, like the types of things we're trying to look for as PTs, and how we treat, various conditions. It was really cool seeing, even though concussion is in its infancy, like what the research has demonstrated right now, and just being able to see that like PT physical therapists have this very wide breadth of like things we can do, things we can learn, because it is about movement, it is about like positioning, but it's much more than that within different respects. So I'm not going to get too crazy with that. I'm just going to say here that like if you are considering the cervical spine manipulation course, if you are considering like hearing about this concussion talk, I really think it was well worth the time. I know that I need to practice with those techniques a lot more, but it was really cool, like me as a student nailing these setups and understanding really what's going on, what I'm trying to palpate for, what I'm trying to feel, seeing everything that I know in my head applied out there. So I'm gonna leave it at here for this talk. If you have any questions, any comments, anything about it, like definitely reach out to me on Snapchat, because that's where I talk to people more, or you could just message me here on Facebook. But all right, hope everyone's having a great time. I will see y'all next week on my next live. I'm gonna be heading out to San Diego this weekend and having a good time with Ben Fung, who's a very influential, prominent physical therapist, and he has this very strong presence on social media. So really excited to meet him in person. We Snapchat all the time, so very excited to finally like see him again after meeting him in person at a PT conference. But all right, adios, deuces.